Hey, welcome to Therapy by Gabby. I'm Gabby. I'm a licensed professional counselor practicing in the state of Wisconsin, and I talk about things for therapists, therapy goers, and the mental health experience in general. If you're not already connected with me over on my other socials, go ahead and check out my TikTok and Instagram. TikTok is where I post most consistently, and you can find me at Therapy by Gabby, which is the same as my YouTube channel. And if you don't already subscribe to me here, go ahead and subscribe and turn on the notification bell so that you can get notified every time I post a video. Today is going to be the long-awaited video on my personal experience with ketamine infusion therapy as a patient. I already filmed this once before, and as I was editing it, I was like, I hate the way this turned out, so I'm going to refilm it, and I really hope it turns out much better this time around so I don't have to film it for a third time. So you will see throughout the video that I'm going to be reading off of my phone. I have a ton of notes on this, and I'm going to do my very best to talk about it in a very linear way so that it's very easy to understand. But before we dive into the nitty-gritty, I'm going to go ahead and start with a huge disclaimer. I am not an expert on ketamine therapy, ketamine-assisted psychotherapy. This video is going to have some general information about ketamine, but it is mostly about my personal experience with ketamine therapy. I am not a doctor, and this video is not a replacement for medical advice. If you are interested in learning more about ketamine therapy, I will go ahead and list some resources in the description box below, and you can check those out. Let's dive in. What is ketamine? Ketamine is a psychedelic drug, also known as a dissociative, and it distorts a person's perception of their environment, and it creates a sense of detachment from their environment. Ketamine is a medication that's often used in hospitals and vet clinics. However, it can be abused, so the street drug name is Special K. I'm not a researcher, and I'm not familiar with all the research on ketamine therapy, but it has been found to be effective in treatment of treatment-resistant depression, PTSD, suicidal ideation, anxiety, and chronic pain. I have heard on podcasts from psychiatrists, as well as I've gone to different ketamine clinic websites, I see that they market for other mental health experiences such as OCD, substance use, eating disorders, and even bipolar. This is where it's really important to consult with an actual doctor, your doctor, who does a full health history to assess if ketamine would be safe or not for you, depending on if you have some of these conditions. Mainly, it is marketed for treatment-resistant depression. Treatment-resistant depression is a form of major depressive disorder where standard treatments like antidepressants and psychotherapy are not effective. It's defined as an inadequate response to at least 2 different antidepressants at the right dose and duration. So what actually is ketamine therapy? This is where it's important to differentiate between ketamine therapy and ketamine-assisted psychotherapy. Ketamine therapy is the use of the ketamine medication alone through different routes of administration for mental health benefits. Ketamine-assisted psychotherapy is where a patient is under the medication of ketamine while having a therapist in the same room with them, providing therapy and guiding the patient through the ketamine process. Therapists do need to be trained in ketamine-assisted psychotherapy if this is something that they are going to provide to patients. I am a therapist, but I am not trained in ketamine-assisted psychotherapy, so that is not something that I do with my clients. And in my personal experience, I have not done ketamine-assisted psychotherapy. I have only done ketamine infusion therapy, so just the ketamine medication by itself. There are different routes of administration for ketamine therapy. There's IV, intramuscular, oral, and intranasally. And there is a brand of intranasal ketamine, I think it's S-ketamine, but the brand is called Spravato, that some insurance carriers actually cover for patients to have access to it. I'm not sure how the different routes of administration work. I only have experience personally with ketamine IV infusion therapy. Why did I personally consider ketamine therapy for myself? I'm going to do my very best to make a long story short. I'm currently 28 years old, and when I was about 14, I started taking an SSRI, an antidepressant called citalopram. The brand name is Celexa. And when I first started that medication, I was taking about 10 milligrams. October of 2024, I was up to 30 milligrams of citalopram. I was also struggling with a lot of chronic health issues last year. I was just chronically sick, virus, cold, flu, I don't know what it was, but I kept getting sick. And in October of last year, after I had recently been sick and taken some over-the-counter medications, I started developing these really big black and purple bruises all over my legs and my arms. I went to the doctor, did blood work, they ruled out anything, the blood work came back clear. And they thought that maybe I was having an interaction between my SSRI and an ingredient called NSAIDs, which is in ibuprofen. And keep in mind, like, I've been on citalopram for like the last 15 years of my life, and I've taken ibuprofen several times in my life. So I don't know why it happened at that time, but they think that that was why I was having so many bruises. And a rare side effect of SSRIs, and specifically citalopram, is bruising. So after consulting with my doctor, my psychiatrist, my therapist, my support people, I decided that I was going to get off of the citalopram and pursue ketamine infusion therapy. And the reason that I didn't want to try any other medications is because, one, I've already tried a handful of medications in the past that did not work for me, and two, with most SSRIs, there will always be a risk of bruising. And given the severity of the bruising that I was having, they were very, very large. It looked like somebody was hurting me. We decided that it wouldn't make sense to go back on an SSRI right now. Once I decided that I was going to pursue ketamine infusion therapy, I did a little bit of research looking for clinics around me. I chose a clinic and scheduled a consultation to talk with their providers. In preparation for that consultation, I wrote down all of my questions, concerns, some of my family health history, because there was some health history in my family that I was worried about. Like, if this is in my family's genetics, is this going to be a concern for me? Is this going to be a risk to my personal safety? And I wanted to be very, very clear about that in the consultation. So I had the consultation with the ketamine provider. I felt good about it. They answered all of my questions. They assessed my health history to make sure that I would be a good fit and it would be safe for me to do the ketamine therapy. Then we started talking about scheduling. The specific clinic that I work with, they recommend that the patients do 3 ketamine infusions a week for 2 weeks, and then after the 6 infusions, then you talk about maintenance therapy. I have heard that some providers have a different schedule of ketamine therapy when patients are first starting out. I assume that maybe there's some general guideline and then clinicians make their best judgments based on what their experience is clinically. I don't know, but the schedule can vary clinic to clinic. I ended up completing 8 ketamine infusions in 3 weeks. I had to extend it out to 3 weeks because I ended up getting sick again during the ketamine infusions. And then by the time I did the 6th infusion, when we did a reassessment of my progress, my PHQ and GAD scale, which is the assessments for depression and anxiety, were still not great. They weren't where we would want to be if the ketamine was effective. So my provider said, you can decide that you want to be done here. The ketamine just wasn't a good fit. Or some people do 2 more ketamine infusions, and that is enough for their system to, finally accept the medication, and that's where they start seeing results. And so I decided, I'm already 6 infusions in. I might as well try the next 2 and see if it works. After the 8th one, there was a significant difference. After completing my 8 ketamine infusions, I have since done 3 maintenance infusions. So my understanding is that the maintenance ketamine infusions depends on each individual person, and when they notice that the symptoms are amping up again, they notice they're feeling more depressed. Some people can go out a really long time before they need to come in for a maintenance ketamine infusion. Some people have to come back every 3 to 4 weeks. Everyone is different. So in my personal experience, for the first maintenance infusion, we went out 3 weeks. Then after that one, we went out 4 weeks. I went out 4 weeks again, and now I have 8 weeks until my next maintenance ketamine infusion. I'm about a month away from that 2-month mark. I am noticing feeling a bit more fatigued, but generally speaking, my mood is pretty good and pretty stable. So we'll see how it goes. Something to know about ketamine therapy is she is pricey. And when I knew I was going to do ketamine therapy, I knew I was going to be spending a pretty penny. However, I somehow got very lucky because the clinic that I chose is actually on the cheaper side. So for the 11 ketamine infusions that I have done so far, I have spent $3,050. Again, that is a lot of money, and it's a huge privilege to be able to afford to have access to this type of treatment. And at the same time, there are a lot of clinics who charge upwards of $400 to $600 an infusion, which I understand. I want people to be paid appropriately, have a living wage, obviously cover the costs of their clinic and the medication. And also it's something that you really have to consider when deciding if you're going to do ketamine therapy or not. In preparation for filming this video, somebody on my Instagram asked if ketamine is dangerous. And I think the answer to that is that it depends. Again, I'm not a doctor, but my general understanding is that it is typically a pretty safe medication. However, there are certain health conditions, mental health conditions, that would rule someone out from being eligible to receiving ketamine treatment. Always consult with your ketamine provider or individual healthcare provider. The reason that I felt safe doing the ketamine therapy is, one, I consulted with my own psychiatrist and my own primary care physician. I also talked about it with my therapist, and I felt very supported by all of those people. I also felt like all of my questions and concerns were answered during my consultation with the ketamine clinic, and I felt like they really reassured me about some of the things that I was concerned about in my family health history, and they made it very clear that based on the health information I was sharing with them, that it would not be a safety risk for me. I also felt safe going into ketamine therapy because as soon as I walked into the clinic, it felt like a very clean, welcoming, warm space. The staff that I work with at my ketamine clinic is also very kind and responsive. I was a little worried about the first time going into the first ketamine infusion, and so I did ask if I could have a trusted person sit in the room while I was under the medication, and they said that that was totally okay. I also felt safe because at the ketamine clinic that I go to, they have cameras in every room, and I assume that as much as that is for patient safety, it's probably also for staff safety because you have patients in very vulnerable positions, and you don't want them to think that anything inappropriate or harmful is happening when they are in that vulnerable space. So I felt safe knowing that there are cameras where monitoring me and monitoring anything that is happening in that room where I'm in a vulnerable space under the ketamine medication. At my clinic, when I arrive for my ketamine infusion, they take me into my private room where there's a recliner. I sit down and they take my blood pressure, and then they get me set up to the IV, and they also hook you up to a heart monitor, which has a call button on it. So they're monitoring your heart rate, as well as if you're in the ketamine infusion and anything happens, you can hit that call button and they'll come in right away and pause the infusion to make sure that you're safe or check in on any concerns that are happening in that moment. Once the staff gets me hooked up to the IV and I'm sitting in the recliner comfortably, they also give me some headphones, which has some, I don't know what type of music, but specific, I think it's called like binaural beats, that is supposed to help like deepen the psychedelic experience. And so they give me those headphones. I really like the music. I think it really does help with the experience. And then they also give you an eye mask and a blanket. Something that's interesting about ketamine therapy is it actually makes you cold, so the blanket is really nice. One of the side effects of ketamine is actually feeling nauseous and getting sick, so they also administer Zofran, and I've personally never gotten sick from a ketamine infusion. Now the fun part. What is it like to be in a ketamine experience? I want to put this out there that before I started doing ketamine therapy, the only drugs I'd ever used were alcohol and weed. And I had only smoked weed maybe 10 times in my whole life. I never really had an attraction to it. I only did it socially, and it actually gave me a lot of anxiety. But aside from those things, I've never had any experience with psychedelic drugs, so I really didn't know what to expect the first time that I went into it. I remember my first ketamine infusion, it felt like my physical body just melted away, and I was in this expansive state of mind, and it was just my soul. And it was just my soul in this very expansive place, and my brain was just taking me and my body, even though you're not moving during the ketamine infusion. You're literally just laying in a recliner. But it felt like my body was just forming to the different scenes that were showing up in my brain, because you do dissociate and go on a trip. And when I go on a trip, it's not necessarily scenes from my own life. It's not necessarily people in my life. Sometimes it is, but a lot of times it's random places that I've never even been, or maybe things that feel familiar to movies or TV shows I've watched, but it's not the same exact thing. I know that there are people who do ketamine therapy and they don't dissociate at all. What I've been told by my ketamine clinic is that even if you don't dissociate and see things, the medication can still be effective. I personally feel and I'm not a doctor, right? I'm not an expert in ketamine, but I personally feel the more I dissociated and the more that I went on a trip, the better I felt. Along with being very expansive, it also feels very meta. It feels like everything is interconnected and we are all attached to each other in some way, shape, or form. And I'm not gonna lie, when I go into that space during a ketamine infusion, it really does freak me out. That's when I notice a lot of anxiety ramping up. Usually that feeling doesn't last for too long. I practice a lot of mindfulness and parts work like internally as I'm going through the ketamine infusion. And I think my knowledge as a therapist, as well as my own personal processing and my individual therapy, does really support me in being able to really just notice and be curious and observe the trip that is happening. So even when it doesn't make sense, even if it feels totally bizarre or I don't understand what's happening, I just do a lot of, I'm just gonna go with it. I'm just gonna follow whatever the medicine is bringing up for me, and I'm just going to notice it. Time feels very different in ketamine infusions. So the ketamine infusions are scheduled for about 45 to 60 minutes, and when you're under the medication, it feels like 10 to 15 minutes. But it also feels like it's going on forever, which I don't know if that makes sense. Time just feels totally different when you're in that dissociative state. Out of the 11 ketamine infusions that I've done, I have only had one ketamine infusion, which was actually my last maintenance infusion, where about 35 minutes into it, I started to have a panic attack and I actually hit the call button. And as soon as I hit the call button, a staff member came right in, they paused the infusion, and they checked in with me. They just said, "Hey, you're safe. I stopped the infusion. I want you to know that you're in a safe space. And when you're ready to let me know what's going on, I'm here." It was only later when I was coming out of the ketamine infusion and doing some journaling that I realized what had come up for me was essentially my biggest fears about, what if I don't get better, and what is that going to look like in my life, and what is that going to mean for my life? And I think that was a pivotal moment for me in my personal healing. And since then, things have been going really, really well. So I don't think that's just the ketamine medication alone. I think that is a combination of what the medication created space for, and then what I was able to integrate myself through journaling, reflection, and my own personal therapy. When I come out of a ketamine infusion, it feels like my brain took a shower. I don't know how else to describe it. It just feels like if you're ever outside doing yard work and you get really dirty and you have like mud all over you and you're sweaty and all you can think about is just going into a nice shower and just washing your body off and feeling clean and fresh. That's how it feels when I come out of a ketamine infusion. I also feel very sleepy because of the medication, which is normal. The first time I did a ketamine infusion, I was like very, very sleepy, very groggy. But as I've done more infusions, that feeling has subsided. I'm not sure about the other routes of administration, but at least with the ketamine infusions, I know you're not supposed to drive for 12 hours, so you do have to have somebody pick you up afterwards. After each ketamine infusion, as I was waiting for my ride to come, I would take some time to journal as much as I could about what came up for me in the infusion. And I don't remember everything, but the things that I do remember, I just bullet point them, and as I notice certain feelings or certain thoughts or memories coming up, I see if I can make some points of connection. I want to talk about this a little bit more because I have heard some other therapists on different social media platforms talking about why they hate ketamine, and they have some valid concerns. I also just want to offer a different perspective. One thing that I've heard other therapists say is that the appeal of ketamine is that it's easy and you don't have to do any work, and it reinforces avoidant behaviors because you just use the medication and then you're better. In my personal experience, ketamine therapy is not without work because yes, the ketamine medication does help a lot, but in my experience, it creates space. It creates an expansion experience for you to be able to do the difficult things that you felt like you couldn't do when you were experiencing deep depression. I'm sure there are people who just use ketamine infusion therapy or ketamine medication and don't do any other therapeutic interventions, and that works for them and they're fine with that. But I don't think it's fair to generalize that all of ketamine is just an easy way out and that it reinforces avoidant behaviors. So here are the things that I did to integrate my ketamine experiences. So like I said, I would journal after every infusion, and then I would bring my journal into my individual therapy sessions, and we would talk about what came up during the infusion, and then we would engage in parts work or brain spotting and further integrate the material that was coming up. And part of that integration process was acknowledging like, okay, these things that I have been avoiding or these things that have been very difficult for me, now with the process that has happened through the ketamine and in combination with my individual therapy, there is more space for me to confront those things. Now is the time to do it. So what has actually changed for me since doing ketamine therapy? The first thing is just that expansion experience. The expansion did not stop when I came out of the ketamine infusion. It continued on into my day-to-day. Obviously not in the same context, like I'm not dissociating in my day-to-day, but the feeling of having an expanded perspective and having more space to process through things or do things that were difficult for me before, and just space to do hard things, even when I feel like I can't. That has been the biggest takeaway. And of course, with that, my mood has improved. My depression has significantly decreased, and I have access to more energy. Now, I've always struggled with chronic fatigue, and like I said, I've had a lot of weird chronic health issues, but generally speaking, I feel much better, much more stable, much more access to motivation and doing things even when it feels like I really just want to lay in bed, but I know that if I do this, it'll feel better. So, okay, I'm gonna get out of bed and I'm gonna do the thing. Some random things that have changed for me, which I contribute to the expansion experience of ketamine, is one, brushing my teeth. I've always struggled with brushing my teeth in the morning. Since doing the ketamine therapy, I have brushed my teeth every single morning. Another random thing that changed for me after ketamine was my relationship to food. So I want to be very clear, I've never struggled with an eating disorder. However, I have had meat aversions and intrusive thoughts about food. And so it was more probably related to some OCD tendencies. And since doing the ketamine infusions, my intrusive thoughts about meat specifically have significantly gone down. And when they do come up, they are much more easy to manage. And so as a result of that, I'm eating more protein, which is probably helping me have access to more energy, which is also probably improving my mood. I do want to be very transparent that as much as ketamine has helped my depression, I do not think it has supported my anxiety as much. So about a month and a half ago, I did decide to go back on the citalopram, however, at a significantly smaller dosage. So I'm currently taking 10 milligrams of citalopram while continuing my ketamine maintenance therapy. And so far, I have noticed a little bit of bruising, but they're much, much smaller. And I talked with my primary care doctor, and they said, given what they're seeing with the bruising, it is not a risk anymore, and my mental health is the priority. And so right now, the citalopram is safe for me, but obviously we're going to monitor it. The citalopram in combination with the ketamine has been perfect. It has worked so good for me. I feel so much better. Something else that I think is worth noting, however, when we're talking about medications, obviously this is not medical advice. Make sure you talk to your own individual healthcare providers. But throughout this process, I was taking Adderall. I had been on Adderall since August of last year. After I got off of the citalopram before I started the ketamine therapy, I was still taking the Adderall. And at that time, I was at 15 milligrams of Adderall. After I started doing ketamine therapy, I noticed that when I would take the Adderall, I would feel really amped up. And so I actually went down from 15 milligrams to 10. And then as I continued the ketamine therapy, the 10 milligrams started to feel really intense, so I went down to 5. And then it got to a point where I was like, I feel so wired. I feel so anxious all the time. I don't know what else it is. So I decided to stop taking Adderall altogether. And I do notice some of the executive dysfunction coming back without the Adderall. However, I feel much, much better. I am sleeping so good now. I have very, very little anxiety, which is managed by the citalopram. And like I said, there is still some executive dysfunction that I'm noticing, but I'm able to manage that in other ways without the Adderall. I don't know if it was just that Adderall was never a good medication for me, or if it was that ketamine changed something in my brain body that Adderall was no longer working well with me. I don't know, but I think that's a really interesting thing to make note of. Now let's talk about side effects. So I don't know all of the side effects, but here are some of the ones that I experienced. On the day of, I did have headaches after the ketamine infusion, and like I said earlier, I felt very sleepy. So I knew that on the days that I was going to have ketamine infusions, I was not going to schedule anything, I was not going to work, I was just going to have my infusion and then take the rest of the day to relax. drink plenty of water, making sure I'm eating like I normally would. This is a weird one, and I'm not sure if it's connected to ketamine, but again, worth noting. I did notice that I was having some memory issues in the beginning of starting ketamine therapy, and more so with like recall. Like I would be trying to say a certain word and I just couldn't recall the word and be able to say it. That has improved a lot since I started ketamine therapy, and I do not struggle with that as much. Now it feels more normal, I guess, like what I would have always experienced even before I did the ketamine therapy. I'm not sure of any long-term negative side effects because I personally have not experienced any. I'm definitely going to continue to monitor. So overall, for me personally, ketamine therapy has been a game changer, and I am really thankful for my experience. I hate that I had to go through everything that I went through to get here. I also don't know if I ever would have considered ketamine therapy if I hadn't started bruising the way that I did. Again, I just want to remind people that this is my personal experience with ketamine therapy, and not everybody is going to have the same experience as me. I've had clients do ketamine therapy and not have any effective results or decide that they just didn't think it was worth it. And this is where it's really important to keep in mind, I'm not a doctor, this is not medical advice, and if you're considering ketamine therapy, consult with your doctor, your psychiatrist, your therapist, consult with the ketamine clinic, and give them a full health history so that they can make an appropriate assessment if ketamine would be safe for you. This is where I'm going to end the video. I'm sure that I missed some information, so if there's any questions, feel free to drop them in the comments below, and I'll probably respond with a TikTok. So this is the reminder that if you're not already following me over on TikTok or Instagram, go on over there and find me at Therapy by Gabby. If you're not already subscribed, make sure to subscribe, like, comment, and turn on the notification bell so you can get notified every time I post a video here on YouTube. Maybe in a year from now, I'll do an updated video on my experience with ketamine therapy, if I'm still doing it, if I'm not doing it, what my experience is like that far out. I don't know, we'll see. But thanks for being here, and I'll see you at the next one.